In this video, we will discuss the considerations when conducting a consultation over the phone and how you can do this effectively. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. Telephone consultations are becoming an increasingly common form of communication used in the healthcare sector. For a patient, they offer a chance to have a consultation when they may be busy or struggle to get to their GP, pharmacy or other healthcare professional. That may be a result of mobility. Therefore, the telephone consultation can be a convenient and quick way of receiving the care and advice they need. However, it's easy to cut corners and fail to clarify certain parts of the patient's story and then miss important details when conducting a consultation over the phone. Although almost all of the communication and consultation skills that we've already discussed on Consultations for Health will apply to telephone consultations, there are some key differences to be aware of. Some of the skills that you've already developed may need to be used in greater depth and with greater accuracy. We've previously discussed the importance of non-verbal cues and picking up on these. However, this is often not available as easily over the telephone. Both the patient and the practitioner cannot visibly see what may be going on. And if this isn't taken into consideration, it could have a negative impact on the overall effectiveness of the consultation. An added complication is that sometimes when a patient is acutely unwell, a third party, such as a family member, may be on the phone on their behalf and may not necessarily have all the information required at the point at which it's needed. With this in mind, we're going to discuss some tips and extra considerations for telephone consultations. Active listening is fundamental in a telephone consultation and needs to be very careful and attentive. You may find it useful to jot down prompts on a piece of paper for things that you want to come back to and address. It's more difficult for a patient to know that you're listening over the phone, as body language and eye contact is a big part of that. Therefore, you will need to use supportive noises or verbal encouragement for the patient to continue what they're saying, rather than just listening in silence. You could say things like, okay, I see, yes, go on, etc. This shows that you're listening and interested. You can also summarise what the patient has told you, which can act to confirm your understanding and will also show the patient that you have listened and understood. In terms of the patient's cues, you only have what you can hear to go by. Pay very careful attention to the patient's verbal cues, including what they say and also how they say it. If the patient sounds concerned, or even say that they're concerned, you need to approach this in an empathetic way. You could say, it sounds like you're quite anxious about this. Sometimes a patient may sound dissatisfied with what you've said. Try to approach in a non-judgmental and non-accusatory way. But you do want to address it. You should respond clearly and verbally to these cues. If you're not getting many cues from your patient, you should ask directly about their ideas, concerns and expectations. This may be the only way to explore the patient's perspective. It's hard to tell how well someone is taking in the information over the phone. So when giving information, it needs to be very clear, simple, and use lots of chunking and checking throughout. Repeating or summarising the management plan more than once can be beneficial, and using the teach-back method can be a good way of repeating the plan near the end of the consultation and checking the patient's understanding. Closing the consultation can also be difficult if the patient feels their needs have not been met. For this reason, providing options can be very useful, as this enables the practitioner and the patient to move forwards together in mutual agreement. If a patient has been given options, they are less likely to feel that their needs have not been met. Finally, It may sound obvious, but make sure you do the things that you would normally do in a consultation, like checking who you are speaking to, asking the patient if they have any further questions, safety netting at the end. All of these skills are still very important. Telephone consultations shouldn't be any shorter than a face-to-face consultation, as you still need to clarify the clinical factors and the patient's perspective more overtly. Check out some of our other videos on Consultations for Health for the skills that are relevant to all types of consultations. In summary, a telephone consultation needs to be slightly more overt. You need to be actively listening, really listening out for those cues that the patient may give, and then using your skills such as chunking and checking and teach back to check understanding. Thank you for watching Consultations for Health. Don't forget to like our Facebook page, follow us on Twitter and subscribe to this channel.